All right, thank you, AV team. Good evening, everyone. So first of all, I'd like to thank EVG Network and my upline. I'm Darren, your MC for this evening webinar. So I'd like to thank all of you for taking your time to join us this evening on this public holiday. And before we begin, our AV team has muted all of you within the Zoom app to allow the session to run smoothly without interruptions. So you can still continue to use chat function with the Zoom app throughout the whole webinar. And we will also have a Q&A segment towards the end of the webinar. You can then unmute and ask your question then, or simply just type in the question in the chat box. So presentation slides and picture will be displayed during the sharing. And if you can't see clearly, you can also, of course, zoom in for a clearer view. So welcome to today's insightful sessions on a topic that is more relevant now than ever, allergies. So did you know that allergies are on the rise globally? So affecting nearly 40% of world population. So from food allergies to respiratory sensitivities to modern lifestyles, including no dietary changes, environmental factors, and even excessive hygiene are contributing to this surge. But here's the good news. Science is uncovering powerful ways to strengthen our immune system and reduce allergic reaction naturally. So today, we are honored to have Denise, a passionate advocate for preventive science of nutritional immunology. So Denise will share groundbreaking insights on how to prevent, manage, and even alleviate allergies naturally, empowering us to take control of our health. So please join me in giving a warm welcome to Denise.
Good evening, ladies and gentlemen. My name is Denise. Let me start by thanking EVG for giving me this opportunity to share this preventive science that brings health and longevity to mankind. Today's topic is allergy awareness. Let me ask a question. Are you worried about allergies? One of my friends asked me. He often has rashes and his skin is prone to redness and swelling. So is this considered skin allergy? Some people say that they will suffer from diarrhea after eating certain food. Does it mean they are allergic to certain foods? Allergies can be extremely annoying. Do you know why this is so? This is because there is no medication to cure allergies. Allergy is common. More and more people are suffering from allergies, especially in developed countries. About 20% of people suffer from allergic rhinitis. In the United States, 40% of the children suffer from allergies. About 6% are allergic to at least one of the food allergens. And 20% of people have had atopic dermatitis. 1 to 18% of people have asthma. It is so common nowadays. How can we prevent it? Under normal circumstances, the B cells in our body will produce antibodies to protect us from diseases. So, what is allergy? Allergies are a battle without enemies. Allergies occur when the immune system launches an attack on non-threatening substances, and the body will have an allergic reaction. The World Allergy Organization reported from 2011 to 2012, about 40% of the people in the world suffer from at least one allergic disease. This proves that more and more people suffer from allergies. When the human body is infected by bacteria or viruses, B cells will produce IgA, IgM, IgG antibodies to fight these germs. As for patients with allergies, his B cells will produce IgE antibodies in a short period of time when he comes into contact with an allergen. This could be life-threatening. For example, some people are allergic to peanuts. When he consumes food that has peanuts in it, his B cells will produce IgE and immunoglobulin within a few minutes to a few hours, which will trigger allergic reactions such as swollen eyes. Allergy symptoms such as itchy skin will also appear. So, what are the common allergies? There are three main types of allergies: respiratory allergy, skin allergy, and food allergy. All allergies are caused by exposure to one or more allergen. First, let's talk about respiratory allergy. What are the symptoms? Sneezing all the time, runny nose, especially when waking up in the morning, nasal congestion at night when sleeping, difficulty in nose breathing, can only breathe through the mouth, Some people will cough constantly. Eyes can easily shed tears unconsciously. And some people with respiratory allergies will also have dark circles under the eyes. This may also be symptom of allergy. About 20% of people suffer from allergic rhinitis. Respiratory allergy, including allergic rhinitis, are mainly because of exposure to allergens like dust, pollen, dust mites, pet dander like saliva and urine, etc. Do you think these dust and pollen are a threat to us? I'm sure no, right? But if our immune system is haywire, it will treat these harmless substances as harmful substances and start attacking them, and these will result in allergies. I believe that we might know people who have asthmatic problems. So speaking of asthma, there are two types of asthma. One is allergic asthma, the other is non-allergic asthma. The symptoms of both asthmas are the same, such as shortness of breath, wheezing, chest tightness, etc. But these two types of asthma are caused by different factors. Allergic asthma is caused by exposure to allergens such as pollen, mold, pet dander, or dust mites. The cause of non-allergic asthma is not derived from allergens. The main reason is excessive anxiety that causes muscle contractions and aggravate the patient's asthma. So, have you noticed it? The same phenomenon also occurs in too intense exercise. When we used to have physical education classes, the teacher will first ask any students who had asthma. That student will not participate in these intense exercises. Some non-allergic asthma is caused by exposure to cold air. We are all familiar with the principle of thermal expansion and contraction, and the same is true from the trachea. When cold air is inhaled, the trachea becomes narrow and the patient has symptoms such as shortness of breath, wheezing, chest tightness, etc. So now, everyone knows how to distinguish it? Next up, let's look at allergy versus colds. Their symptoms are very similar. So how to distinguish it? Respiratory allergies and colds can also cause runny nose, nasal congestion, sneezing, wheezing, watery eyes, or itchy eyes. But what are the differences between the two? Let's start with their causes. If it is an allergy, it is because of the contact with the allergen, so there will be no fever. Most colds are caused by viruses. In addition to the symptoms that just mentioned, there will be fever, sore throat, and body aches, etc. For the warning period, if an allergic person is exposed to the allergen, his symptoms will surface immediately. So, what about a cold? He will be infected with a cold virus for a few days before these symptoms surface. For the duration, if you are allergic, as long as you continue to be exposed to the allergen, the symptoms will continue to occur. Having a cold is different. The immune system can destroy the virus in a few days, and the symptoms will disappear after that. The difference is here. Next up, let's look at another type of allergy. In our daily life, skin allergy is quite common. Skin allergy can affect the patient's daily lifestyle and work. It will become more serious if no preventive measures are made. The most common skin allergy will cause blisters, redness, itchy skin, and you will tend to keep scratching. That will cause dry cramps like skin peeling. So, what are the allergens that cause skin allergy? The skin allergy main allergens are mostly related to drugs, cosmetic, chemicals, or metal-related substances. Some people are allergic to drugs. For example, some people are allergic towards antibiotics. Some people are allergic towards painkiller or allergic towards ointment application. And once applied, it causes adverse reaction. Allergy symptoms include redness reactions, especially around the eye area, or swelling around the mouth area. If compared with oral drug, frequent partial smear drug or drug injection will trigger allergies easier. Cosmetic. Most women are careful in cosmetic selection. Some of them may be allergic towards some of the ingredients. Usually, immediate application will cause itchiness instantly, redness, and even skin peeling. Our daily use supplies also contains chemical material. For example, detergent powder, dishwashing liquid, etc. Have you ever seen people with hand eczema? When their hand touches some of these substances, they trigger allergies instantly and will even crack and bleed. Some people are allergic towards fabric like sweater or wool clothing. Once they wear it, it will cause allergic symptoms. For metal, some people can't wear earrings and necklaces that contains metal. Whenever they wear it, their skin will have redness and itchiness. Some portion of the skin will be blackened and will cause pus if it becomes serious. Therefore, you need to avoid wearing these metals. Mosquito bites also will cause allergy. But do you know what's the most common skin allergy is? Around 20% of people had atopic dermatitis, problems which is eczema. Wow, that means 1 out of every 5 person will have eczema problem. Actually, eczema is the most common skin allergy. A lot of eczema problems are caused by food allergy. What are the other skin allergy problems? They are rash, dermatitis, boils, etc. When it comes to food, many people think it will only affect digestion. In fact, it will also affect skin eczema and cardiovascular systems too. Food allergies are common nowadays. In the United States alone, about 5.9 million children and 2.3 million adults are suffering from food allergies. Common food allergy symptoms are vomiting, nausea, abdominal pain, and diarrhea. Let's take a look at what kinds of foods are generally more likely to cause allergies. Main allergens in general are milk, eggs, fish and shellfish, nuts, and other foods. These are the foods that can be acquired easily and consumed. Have you noticed what will happen when some people drink milk or eat food containing dairy products? They might end up vomiting or having diarrhea. Some people's skin will immediately turn red when they eat seafood like shrimps, crabs, or shellfish and peanuts. Sometimes it will be red, swollen, and itchiness around the mouth. This is also a food allergy. Therefore, people who are allergic to certain food should be especially careful when choosing food and pay attention to what foods you are allergic to. Some food containing these ingredients can also cause allergic reactions. Dairy products can easily trigger allergies. Dairy products such as cheese, milk tea are all made from milk. However, some people may not be allergic to milk, but to the antibiotics in the milk. How did this happen? Because milk is produced by cows, am I right? Some farmers will inject penicillin, which is an antibiotic, into cows, mainly to treat cows for mastitis. Then, the milk produced in the next 48 hours will contain a small amount of antibiotics. People who are allergic to this antibiotic will cause allergic symptoms if they drink milk contaminated with antibiotics. Milk can also stimulate the body to produce mucus, worsening the symptoms of blocked lungs and cause wheezing. Another type is margarine, which is usually used to spread on bread or make pastry. It will increase the risk of asthma and allergic rhinitis. This is because margarine is rich in omega-6 fatty acids and is easy to cause inflammation. The possibility of triggering asthma also increases. So abstaining from dairy products can improve asthma and allergic rhinitis. Let's take a look at a study of 24 asthmatics. After they let these people suffering from asthma experience a vegan diet for 4 months, the research report pointed out that 71% of patients have improved. The milk protein in milk may be the likely cause of allergic asthma. Food allergy and intolerance are two different things. They are completely different. When we are sensitive to a certain food, that is intolerance. It's not that you are allergic to that food. It's just that you are more sensitive to that food. Especially when consuming milk, gluten, coffee, etc., there may be some symptoms and also a little discomfort. It will cause a reaction in the digestive system, but generally it is not life-threatening. Some people are lactose intolerant. He may be missing an enzyme that can digest lactose. Or maybe there are some people who have skin intolerance, which means that he will have indigestion after eating foods containing skin texture. This is not an allergy. It is just an intolerance. If it's intolerance, our body can slowly adapt to it. For example, you are intolerant to coffee. At the beginning, when you drink a lot of coffee, your heart will start to beat very fast. Then you drink a bit of coffee every day. You will find that your body can adapt slowly. Your body will not beat so fast the next time you drink coffee again. So intolerance can be adapted. But if you are allergic, then it's not. What kind of environment will increase the risk of allergies? In an excessive clean environment, the body will not be able to be exposed to certain types of microorganisms. Actually, exposing a child to microorganisms from an early age can enable his or her immune system to learn how to initiate a corresponding defense response. It is easy to cause allergies if the immune system is not exposed to enough microorganisms to be trained for. This is especially so for small-scale families where there is only one child in the family. When you have less contact with animals, when there's no pets in the house, and when you have less contact with harmful bacteria. An excessively clean environment, such as those with OCD, always sterilizes everywhere in the house, can be easily allergic. Scientists have found out that in countries with poor sanitation conditions, their children have parasites in their body. Therefore, asthma or allergies seldom happen to them. This is because their immune systems focuses on attacking these parasites and will not pay attention to the pollen that is harmless to the body. In short, allergies means that our immune system has no real enemies to fight with and gets bored over time. So, how can we prevent allergies? Here are some tips for pregnant women. Avoid smoking or inhaling secondhand smoke during pregnancy. Consume right amount of nuts if the pregnant woman is not allergic to it. If healthy and do not have any medical conditions, go for natural birth. Because the babies born naturally will pass through the mother's birth canal, and the babies born by cesarean section will be deficient in these bacilli without passing through the birth canal. For a newborn baby, these harmless bacilli can be used for the baby's immune cells to train his immune system. On the contrary, if the baby does not come into contact with these bacilli through the birth canal, his immune system may not have anything to train with, and this can lead to allergies. Babies born by cesarean sections are 5 times more likely to have allergies than babies born naturally. So, any tips for parents? Breastfeed as much as possible because breast milk is good for the baby's health. Breast milk is also the best source of nutrition for babies. It helps children maintain a healthy weight because overweight and obese children may increase the risk of allergies. Let babies 4 to 6 months old be exposed to food that is prone to allergies. For example, eating a small amount of nuts, eggs can help prevent allergies. For babies who are under 2 years old, avoid taking antibiotics because antibiotics can lead to asthma. At present, there are no medication that can completely cure allergies, but it can only help to relieve symptoms. There are some drugs commonly used to relieve allergic symptoms, such as steroid, antihistamine, or decongestant. Although these drugs can relieve allergic symptoms such as sneezing, runny nose, but these drugs come with serious side effects. For example, regular use of steroid, which can suppress the overall immune system function, can result in easier infection by bacteria and viruses and increase the risk of cancer. If these drugs are used for a long time, they can also affect the growth and development of children. Some people don't want to use Western medicine and use Chinese medicine instead. But do not take it lightly, because all medicines have a certain level of toxicity. In addition, all medicines, once the concentration of Chinese medicine is too high, there will be side effects. And many Western medicines are extracted from Chinese medicine. Both Chinese medicine and Western medicine comes with side effects. Are there any other methods that we can use that does not have any side effects and can treat allergies? We can fight against allergies with the power of nature. The power of nature comes from plants, including cactus, American ginseng, Cordyceps mycelium, rose, ashitaba, psyllium husk, and soy. When allergic, our body will be in a state of inflammation, and the cactus is rich in more than 10,000 kinds of phytochemicals. It can exert a good inflammatory function to relieve allergic symptoms, and also the ability to accelerate tissue regeneration and wound healing. It contains a nutrient called mucilage, which coats the stomach and gastrointestinal tract, soothing digestive issues. Most people with allergies will be listless because of allergies. American ginseng can replenish energy and release fatigue. It can also quickly transport oxygen, nutrients, and immune cells in the body to the whole body. It can strengthen the function of the lungs. Studies have found that American ginseng can alleviate cold symptoms, reduce the number and days of colds, and can prevent respiratory infections. Cordyceps mycelium is rich in polysaccharides and gives a two-way normalizing effect on our immune system. So, what is a two-way normalizing effect? It is to activate the weak immune system and at the same time to stabilize the overactive immune system. Therefore, cordyceps can improve immune system disorders and diseases caused by it, including cancer, allergies, and lupus, etc. It also has anti-inflammatory and anti-infective effects, so it can fight viruses. Cordyceps can also strengthen the function of the heart, kidneys, and lungs, relieve cough, and reduce phlegm. The Beijing Medical College conducted a study of more than 50 asthma patients and found that a group of people who took cordyceps had their symptoms relieved by 81% within 5 days. The vitamin C in buds of roses is 50 times that of lemons. So, what are the effects of super antioxidants on people with allergies? The most troublesome things for people with skin allergies are dry skin and dandruff. Often scratches and itching leads to skin ulcers, so you need to take high antioxidants such as rose, which can promote the body's ability to produce required collagen, accelerate skin repair, and wound healing. Moreover, the antioxidants of rose can also prevent DNA damage, strengthen the body's immune system, help reduce inflammation, promote wound healing, and relieve allergic symptoms. Here is a magical plant with super vitality in nature. If I pick its leaf today, it will grow new shoots tomorrow. This magical plant is ashitaba. Ashitaba contains flavonoids which can reduce risk of cancer, heart disease, asthma, and stroke. Ashitaba also contains yellow angelica alcohol B, C, and E, which can inhibit the release of histamine, thereby preventing allergic reactions. The chlorophyll in it also promotes the growth of probiotics in the intestines, thereby preventing allergies. The US Government Dietary Guidelines 2015 recommend that women need about 25 grams of fiber a day, and men need slightly more, about 30 grams per day. Lack of fiber leads to a lack of probiotics in the intestines. Fiber can promote the diversity of probiotics in the intestine, which has been shown to reduce allergies. There are two main categories of fiber, insoluble and soluble. Insoluble fiber doesn't dissolve in water, while soluble fiber does. Insoluble fiber helps our bowels by forming the mass that moves through our digestive system and is key to preventing some digestive conditions such as diarrhea and constipation. Soluble fiber becomes gel-like in water and is key to helping stools move smoothly through the intestines. Therefore, I strongly recommend using psyllium husk because every 100 grams of psyllium husk contains 71 grams of soluble fiber, which is 7 times that of oats. So why do we need protein every day? Because the main function of protein is to build tissue. It is the main structural component of all cells of the human body, skin, hair, nails, and bones. But I mentioned earlier that all kinds of animal food such as eggs, seafood, and dairy products protein can cause many types of allergies. Not to mention that animal foods contain high cholesterol, but also high calorie and fat intake can cause overweight or obesity in children, which may increase the risk of allergies. So, how to choose a source of protein? Soy is one of the best source of protein. Soybean contains 36 to 56% of protein, and its protein is 2 times that of meat, 3 times that of eggs, and 12 times that of milk. Soy protein can increase the proportion of muscle, burn fats, burn calories, prevent obesity, and reduce allergies. Soybean does not contain cholesterol and is low in calories and fats. It is also rich in all the essential amino acids, vitamins, and fiber of our body. Studies have shown that after 4 months of vegan diet for 24 asthmatics, 71% have improved. Children grow up only once, so they need to be supplemented with the highest quality soy protein to help them to grow and improve their memory and learning ability. There is currently no cure for allergy, but only certain medication that may relieve symptoms. What should we do to keep ourselves away from allergies? First, we have to figure out allergens. We may observe our daily activities to determine allergens. For example, jot down what kind of food causes your skin redness and itchiness. This is an effective way that we should practice every single day to find out what triggers our allergies. Secondly, conducting skin and blood tests can identify which substances we are allergic to. Therefore, the only way to prevent allergy is to figure out the allergens and completely avoid your exposure to it for at least 5 to 7 years. This way might reduce the condition of our body towards allergen and eventually alleviate the allergy reactions. Please remember, don't challenge the allergens as it will increase the severity of allergic reactions. There was a shocking news years ago where a lady died from an allergic reaction after kissing her boyfriend who had eaten peanuts. This news is resurfacing now to spread awareness of allergic reactions. We must not underestimate the severity of allergic reactions. However, there are also some people who cure their allergies naturally. Therefore, we must do our best to keep a healthy lifestyle. Now, let me share with you the secret of health and longevity. I believe that we all know how important our immune system is. A healthy immune system can protect us from more than 90% of diseases. Therefore, we must master the science of nutritional immunology to take good care of our immune system. Besides that, there are 4 important habits that we must practice every day to achieve health and longevity. First, sufficient sleep. Why is it important to have sufficient sleep? A research shows the fatality of mice with insufficient sleep, while mice with sufficient sleep live longer. Insufficient sleep can cause the growth of cancerous cells, hallucination, and death. Therefore, we must get enough sleep at least 6 to 8 hours every day. Next, exercise regularly. Exercise is extremely good for our lymphatic circulation and boosting our immune system to fight against diseases. Next, be joyful and cheerful. Research shows that joyful people have less chance of having heart diseases and tend to have healthier blood pressure and cholesterol level. Lastly, maintain a balanced diet. Nutritional immunology taught us the 3 essential nutrients for a strong immune system, which is phytochemical, antioxidant, and polysaccharide. With a strong immune system, we can achieve health and longevity. With this, my sharing ends here. I wish everyone good health and happiness. Thank you.
Thank you, Denise, for such wonderful sharing. So I saw from the chatbot, it's very busy early on. Yavis mentioned about the nature of the plant-based fruits and veggie are powerful. Yeah, indeed. And Sinji mentioned that medication always come with side effects. Yeah, so we now know that better not with the medication. Right. So again, thank you, Denise, for your enlightening this presentation on allergies, a condition where the immune system mistakenly attack harmless substances like pollen, food, and chemicals. So Denise also explained the three main types, respiratory, the skin, and food allergies and their symptoms, which can range from very mild discomfort to life-threatening reaction. So importantly, Denise also discussed preventive tips, especially for the pregnant woman and parents, emphasizing on the role of a balanced diet and lifestyle. While there is no cure, we heard about managing symptoms and the powerful nutritional immunology, focusing on plant-based nutrients to support the immune system. And finally, the needs also stress the importance of identifying the allergens and adopting healthy habits, sleep, exercise, positivity, and nutrient-rich diet. That is nutritional immunology food for overall well-being and a stronger immune response. Now, has anyone benefited from consuming nutritional immunology food? This is definitely a yes. So in our next segment, we have Annie Teo, who will share her personal journey of navigating her child years-long struggle with severe eczema triggered by food allergies, starting from the age of 1. Now, let's hear how nutritional immunology play a role in her child improved health. And before we invite Annie for the sharing, I would like to seek everyone cooperation by not taking any photo during the testimonial sharing. So now please welcome Annie.
Good evening, everyone. I'm Annie. Tonight, I would love to share with you the testimony of my daughters. At the age of 1, she developed eczema due to food allergies. Her face, fingers, and in between her feet were swollen, red, and blistered. Almost every single night, she couldn't sleep well due to this severe itching. Constant scratching until she bled, only falling asleep from exhaustion. As a mother, seeing my daughter suffer like this every single night broke my heart, and I didn't know how to help her recover. I remember every time when we went out shopping, everyone, children especially at her age, would stare at her for a long time, wondering why she looked so different. At that time, I didn't know when her skin would return to normal. My heart sank, feeling utterly helpless. As in the picture, we can see her both face, the cheek, and especially above her eyelid, they are all red and swollen. And her fingers on the joint part would crack and bleed, and also her legs. We went to doctor every month to get steroid creams, but they did not help much. The symptoms of redness and swelling with blisters persisted. The doctor advised us to avoid allergen food like dairy products, shellfish, and acidic fruits. However, she loves her strawberries, lemons, cheese, pizza, creamy pasta, and anchovies. Those foods are almost forbidden. Also, I heard about a method where if someone is allergic to something, they should consume small amount of it to build tolerance. So I tried, but inadvertently, she still consumed allergens in her daily diet. Her skin has no chance to heal because every time it flared up, it set back a long time. I vividly remember seeing her staring at her scratched finger once, and my heart just went sore and broken because I could feel her pain and her sense of imperfection. She would ask, "Mom, why are my hands and face look so different from other children? When are they gonna be back to normal?" I could only reassure her that it would get better soon and asking her not to worry. When she turned 5 years old, my sister in Singapore introduced me to nutritional immunology, this preventive science. It emphasizes that the best doctor in the world is our own immune system. So I started incorporating foods that are high in phytochemicals, polysaccharides, and antioxidants. For example, like cactus fruits, rose, acelera cherries, cranberries, cordyceps mycelium, ABM mushrooms, blueberries, cassia tora, hawthorns, soy, raisin tree fruits, monk fruits, and ginsengs into her diet. After a few months of this balanced, pure, and right nutrients, surprisingly, her skin has improved. Her immunity obviously has increased, and the frequency of eczema flare-up has decreased. She's a very confident and happy little girl now. Let me show you her recent picture. There you go. I'm grateful to Dr. Chia Fei Chen for her amazing preventive science and the convenient, wholesome food. This unique field of nutritional immunology teaching us how to nourish our immune system daily to help us preventing above 90% of diseases. That's all from me. Thank you and have a great night.
Congratulations, Annie and her daughter, for regaining back her health. Now, so we have a disclaimer. So I'd like to highlight that elite products are plant-based food, which are very beneficial for health maintenance. However, elite does not advocate any form of self-diagnosis or medical treatment. So if you have any medical condition, please seek professional medical help. So now we have come to the Q&A segment. I believe that through the sharing just now, you may have a question to ask. So you can unmute to ask the question or simply just type in the chat box. So we will try our best to answer all your questions, and please limit to one question per person. So let me just take a look at the chat box. So okay, I'm seeing the latest one here. I think there's another one as well. So the latest one here, I see that there are two questions. So the first one here I see is hi, should we start taking medicines immediately when we catch a cold or come down with a fever? This is an excellent question. So is there anyone from our Q&A team who can assist with this excellent question?
Hi, MC. I can help to answer these questions. Hi, good evening, everyone. I'm Cindy. Let me repeat the questions here. Should we start taking medicine immediately when we catch a cold or come down with a fever? This, in fact, are very good questions, as I also used to think that once we fall sick, we will need to take medicine immediately in order to get well faster. So let us begin by examining what happens when we fall sick. Let me share my slide here. So, when we get sick, we often experience symptoms like fever, cough, and runny nose. Actually, a fever is not an illness on its own. Most of the time, these symptoms are caused by viral infections, and the fever is actually just a sign that the immune system is hard at work. When we are infected, the immune system raises our body temperature by secreting certain chemicals. This helps to increase the productions and the activities of our immune cells, and it also slows down the foreign invaders' ability to reproduce. So if a person's body temperature is below 40 Celsius, it's not life-threatening. If we take medicine to bring the fever down too soon, we might actually make it harder for our immune system to fight off the infection. Also, when we have a cough or a running nose, that's actually our body's natural way of producing phlegm to help expel out viruses and bacteria. Coughing and sneezing help expel that phlegm, which is the body way of getting rid of the invaders. So again, these symptoms are just signs that our immune system is actively fighting an infections. As mentioned earlier, many people also will resort to taking medications once the symptoms start to appear. What do these medications actually do to our body? Do they really help us to make us well? So let us take a look to the next table here. Here is the listing of all the common medication and the possible side effect. Firstly, we have cough medication, and the possible side effect will be addiction to this cough medication. And the other one will be very common use fever medication to reduce our fever. Actually, fever medicine is very harmful to our liver and kidney, and it may cause the failure. And if we take a look at the historical trend, fever medicine actually is linked to about 450 deaths in the US every year. So we have really had to think that twice when we are consuming all these medications. Next, antibiotics actually kills bacteria, but it can also cause bacterial resistance. If we consume too much of it And at the same time, it can also cause allergic reaction. Furthermore, steroid is a medication to suppress our immune system to prevent things like allergies or other types of symptoms in the body, but it has an increased risk of cancer. The next one that is very common is painkiller. It can help to relieve pain. However, it can actually result in peptic ulcer bleeding in the stomach. So there are indeed a lot of side effects in medication. The more I learn about nutritional immunology, I understand the best doctor in the world is actually our own immune system. So now, let's take a look. What is our immune system can actually do? On the left, we have our B cells. B cells are responsible to produce the antibodies to fight off viruses and bacteria. They are capable of producing 1 billion different types of antibodies over a lifetime. And most importantly, it has a memory functions. If the same virus or bacteria shows up again, it will more quickly be able to get it out of our body without any side effect. In the medical world, there are actually fewer than 300 types of antibiotics. They don't work against viruses. It can only fight bacteria. It may cause the side effect, as I mentioned earlier. Next, on the right, we have macrophage. Macrophages are capable of cleansing the body of debris and our old blood cell. On top of that, they also secrete certain chemicals to summon other immune cells to the better side to fight off foreign invader. As a result, our body clears out these invaders through things like daily waste, phlegm, or pus that sometimes appears during infections. So, how can we make sure our immune cells are doing their job to keep us healthy without depending entirely on medications? That's where nutrition immunology comes in. This field has been researched for over 30 years, focused on 3 powerful disease-fighting nutrients: phytochemicals, antioxidants, and polysaccharides. While most of us get enough basic nutrients like carbohydrate, protein, and vitamin from our daily diet. But in fact, many people are lacking the 3 nutrients to help build out balanced immune system. Firstly, we have phytochemicals. Cactus has 10,000 types of phytochemicals. Cactus itself also have disease-fighting properties, anti-inflammatory, antiviral, inhibit tumor formation, reduce LDL cholesterol, and also prevent high blood sugar level. And the next nutrient is antioxidant, where rose content 50 times higher than lemon. The antioxidant helps to prevent the free radical damage, promote wound healing, antibacterial, anti-inflammatory, encourages the immune system's cleansing function, and boosts the immune system. And lastly, the third key nutrient is polysaccharides, which are found in cordyceps mycelium. It empowers a weakened immune system and also it soothes it when it is overreactive. Besides cordyceps mycelium, various types of mushroom like ABM, maitake, shiitake mushroom also contain polysaccharides. They can promote the action of our macrophage and natural killer cell. By doing so, actually our immune cell can destroy viruses faster, inhibit the tumor growth, and also defend against the further spreading of tumor to other parts of the body. So to summarize my sharing today, when we are sick, the symptoms we experience are actually signs that our immune system is doing its job. Medication may help to relieve those symptoms, but it doesn't cure the illness. The recovery still depends on the strength of our immune system. To recover more quickly and stay healthy, it's important to support our immune system by eating food rich in phytochemicals, antioxidants, and polysaccharides. So I hope I have helped to answer these questions. Thank you.
Thank you, CD, for answering this question. So it turns out, those symptoms like fever and cough often means our amazing immune system is actually fighting off the illness. So while medicine, ease the discomfort, it doesn't cure. So let's focus on boosting our immune system with things like phytochemicals, antioxidants, and polysaccharides for a real recovery. Now, I also see another question earlier on by Jaylene. Jaylene was asking, what can I eat to cure allergies? So is there anyone from the Q&A team who can answer this?
Hi, Darren. This Daniel here. Maybe I can help to answer Jillian question, right?
Thank you, Daniel.
So I know that Jillian is asking these questions whereby what can I eat to cure allergies? So I'm not sure what types of allergy that Jillian is facing now, but it's okay. Yeah, just maybe I can do a summary lah. Unfortunately, there's no food that can completely cure the allergies because allergies are caused by our overactive of our immune response to all those harmless substances. That's the reason why we need to actually um, boost up our immune system, whereby like certain plant-based food that the speaker has mentioned can actually help to manage and also help to reduce all these allergic symptoms by strengthening our immune system and lower down all this inflammation. So the speaker actually has mentioned, I'm not sure whether you have heard that the foods that helps to relieve our allergies are those like we have mentioned before, the cactus, which has 10,000 types of phytochemicals that can help to have these anti-inflammatory properties, and also this ashitaba. Ashitaba have these flavonoids that help to block the histamine release that can help to, which is the key allergy trigger. So it also supports our guts health and reduce the inflammation. And the speaker also mentioned like food, example, psyllium husk, which is high fibers, that helps to improve our gut health and also to reduce the allergy risk. And also rose, that extremely high in vitamin C, that help to repair our skin and also to reduce the allergic reactions. And American ginseng that helps to boost our energy and also supports our lung function and also helps to prevent the infection, all that. And don't forget about cordyceps mycelium that actually helps to regulate our immune system to calms all these overreactions of our immune system. Also, cordyceps mycelium also helps to reduce the inflammation and also improve our lung function. And we also have soy protein, which is a very clean and plant-based protein source. And as a person that have a lot of allergy, they need to avoid the animal proteins, which can worsen our allergies. And then last but not least, do avoid those dairy products, which can actually worsen, for example, asthma, can also worsen all these allergies. And then stay away from all those food allergens that speaker had mentioned, peanut, shellfish, eggs, all that. And have a balanced and plant-based diet that full of antioxidants, phytochemicals, and polysaccharides. So all the ingredients that I mentioned above, actually, you can find it at our Elite products, whereby you can find out more from the person, from your friends that brought you here. Yeah, hope that I can answer your question. Thank you.
Thank you, Daniel. Thanks for the summary. So indeed, yeah, so there's indeed no cure at the moment for allergies. And of course, the best way at the moment that we have know of is by managing the symptoms. And of course, what you mentioned, using nutritional immunology food, so such as those that are rich in phytochemicals, antioxidants, and polysaccharides. So I hope that has answered your question, Jalen. And then let's see if we have any more question. So I do not see any more question, and so we shall now end the Q&A segment here. So next, I would like to share some event news and promotion.